One of the most overlooked but deeply concerning risks associated with red yeast rice supplements is contamination with citrinin, a toxic byproduct of fermentation. Citrinin is a mycotoxin, a type of mold-based compound produced by certain strains of fungi, including Penicillium, Aspergillus, and notably Meniscus purpureus, the very organism used to ferment red yeast rice. While red yeast rice is often marketed as a natural alternative to statins for lowering cholesterol, when improperly manufactured or inadequately screened, it may deliver not just therapeutic compounds like monocolin K, but also harmful contaminants like citrinin that pose serious health threats, particularly to the kidneys and liver. Citrinin has been well documented in scientific literature as nephrotoxic, meaning it can impair kidney function. It damages renal tubular cells, impairs mitochondrial function, and induces oxidative stress, which in turn leads to cell death and reduced filtration capacity in the kidneys. Chronic exposure, even at low doses, can be insidious, gradually leading to irreversible kidney injury over time. While acute kidney toxicity from citrinin is rare, repeated ingestion, especially in people who already have compromised renal function or who take other nephrotoxic substances such as NSAIDs or certain antibiotics, could significantly accelerate kidney decline without obvious early symptoms. The liver, too, is at risk. Although citrinin's liver toxicity is somewhat less well-studied than its renal effects, evidence suggests it can induce hepatic oxidative stress and inflammation. In animal models, citrinin exposure has been shown to elevate liver enzymes and disrupt normal hepatocyte function. Combined with the known hepatotoxic potential of high-dose monocolin K, this creates a dangerous double burden on the liver, especially for users who assume that supplements are harmless and who may also be consuming alcohol or using other liver-metabolized supplements like green tea extract or niacin. What makes this threat even more alarming is that citrinin contamination is largely invisible to the consumer. There is no way to detect its presence by sight, taste, or smell, and most supplement labels do not mention citrinin at all. Quality control varies dramatically between brands, and there is no global standard for maximum allowable levels of citrinin in red yeast rice products. In the US, the FDA considers any supplement containing monocolin K to be an unapproved drug and, by extension, makes no allowances for citrinin regulation. In the European Union, where citrinin is recognized as a serious risk, authorities have set maximum limits, but testing is still inconsistent. A number of studies have found that many red yeast rice supplements, even those purchased from reputable vendors, contain detectable and sometimes dangerous levels of citrinin. This problem is compounded by the fact that red yeast rice is often marketed to people with underlying metabolic or cardiovascular conditions, populations that already have elevated risk for kidney and liver dysfunction. Individuals with diabetes, hypertension, or early-stage chronic kidney disease may reach for red yeast rice thinking it's a safer, more natural option than pharmaceutical statins, not realizing that they are exposing their vulnerable organs to an unregulated compound that might worsen the very conditions they're trying to manage. Even users who take relatively low doses of red yeast rice over long periods are not exempt from danger. Mycotoxins like citrinin do not need to be consumed in large quantities to cause harm. Their toxic effects are cumulative and often silent. By the time kidney function begins to decline noticeably, with symptoms like fatigue, changes in urination, or fluid retention, damage may already be substantial and irreversible. Liver damage from citrinin may likewise progress quietly, presenting only when enzyme levels rise or jaundice sets in. Another layer of risk involves co-exposures. Because red yeast rice is often combined with other supplements such as coenzyme Q10, milk thistle, turmeric, or green tea extract, all commonly used in cardiovascular support regimens, users may be unknowingly creating toxic synergisms. For example, green tea extract has its own known potential for liver toxicity. Combining it with citrinin-contaminated red yeast rice could result in compounded oxidative stress on the liver. Similarly, combining citrinin with acetaminophen or ibuprofen, common over-the-counter drugs, increases the strain on both the liver and kidneys. Consumers cannot rely on marketing terms like natural, fermented, standardized, or even organic as indicators of citrinin safety. Unless a product is independently tested and verified to be citrinin-free, a claim only made by a small number of high-end or European-regulated brands, there is no guarantee that the supplement is safe. And even third-party testing is no guarantee if the results are not current or publicly available. The unfortunate reality is that citrinin contamination remains one of the least acknowledged yet most serious threats posed by red yeast rice supplements. Until manufacturers are held to stricter quality control standards and consumers are better educated about the risks, people will continue to be exposed to hidden toxins in products that claim to be safe, natural, and health-promoting. For individuals who truly require cholesterol-lowering therapy, the safest option is to consult a healthcare provider and use regulated medications that are backed by rigorous testing, known dosing, and clear safety profiles, not rely on a supplement that may quietly be delivering a dose of mycotoxin alongside its supposed benefits. In short, citrinin contamination turns red yeast rice from a questionable supplement into a potentially dangerous one. The absence of mandatory screening, combined with the public's misplaced trust in natural labels, creates a perfect storm for harm, one that can strike the kidneys, liver, or both, and often without early warning signs. This is not a benign or harmless wellness hack. It's a risk that demands caution, oversight, and much greater public awareness.